Thank you, Chair, and thank you for all the different perspectives that everyone is sharing. I've got a fundamental question, especially coming from what Jeffrey has shared. In this coordinated response or whatever, I feel whether it is timely to totally restructure our hospitalization and polyclinic approach in making it classless. The A class can remain A class because the super rich perhaps needs fantastic care, but I think they should be outsourced to the private sector and full stop. But the rest of us, and Singapore, it's not only a government issue now. Singaporeans already have this expectation, C class, B1, B, why? That will give an even spread of personnel, consultants, specialists, doctors, nurses, everybody. I would like to hear the views of the different representatives, how they view this as an approach going forward. A second point, please. I just need to address what Mr. Jeffrey has shared in terms of foreigners. We all know that even the lowest stream of foreigners in our society today pay private rates already, whether it's polyclinic or whether it's in the hospital. Whether it's covered by insurance is a separate question. And I totally agree with the point of view that you have shared. I didn't get your name, the representative from Reform Party. We are all caught up in this demographic shift. Suddenly there's this influx and there's a squeeze, as Paul has pointed out, in the public sector. So going back that question on this point, going back to you, Paul, on this question, I thought you highlighted a systemic flaw in our system, the private sector and the public sector. I would like to hear more on your thoughts of making it a bit more of an even approach. Thank you.
You can take the second question. Yeah.
I think that's a very good question, and I actually have given this feedback to Ministry of Health before. You know, they are very concerned about senior doctors leaving the private sector, and I'll be very honest with you, they're giving us a huge chunk of money to try and persuade us to stay in the public sector. And I made a point of donating half of it to various civil society causes, because I think that doesn't work. You see, if you keep trying to pay doctors in the public sector more to stay in the public sector, all you're doing is you're telling them that they can earn that amount more in the private sector. And I told them, you see, people stay in the public sector for several reasons. I stay there because I like the teaching, I like the research, and I like looking after poor people. You see, if I wanted to get a lot of money to look after rich people, I go to Mount East straight away. It's so much easier to do that. I'll be my own boss. I don't have to follow all the rules and regulations. But the fact is that doctors, and there are many doctors in the public sector who stay in the public sector because they like teaching, they like research, and they like looking after poor people. So you just need to make it easy for them to do that without all the bureaucracy, without all the paperwork that comes with the administration and stuff like that, and people will stay. So I agree with you. You know, the old pediatric wards in SGH was called the Mystery Wing because it was donated by Mr. Mystery. And at that point in time, it was classless. See, he said one of the conditions of his donation when he built that ward was that there was no class. You see, you're a child, you're sick. There's no such thing as A class, B class, or C class for a child who was sick in his thinking. And that was the philosophy behind the old SGH Mystery Wing wards. Currently, the ICUs are classless because they recognize if you're critically ill, you know, it's not going to make, you don't want to start deciding whether you're A class, B class, or C class. But once you leave the ICU, you're stuck in the system, see? And then finally, the last point is that the public sector should not compete with the private sector for medical tourism. Medical tourism is fine. You know, we have really good hospitals. And I think part of the reason why this thing about the public sector dealing with medical tourists is the underfunding. You know, the fact that we have to find some way to try and fund the care of the poor patients. The other part of the problem is this trust issue, which I want to come back to. See, because the administrators look around at Southeast Asia. See, if you go to a hospital in one of the developing countries in Southeast Asia, the doctors are allowed to have private practice. So what they do is they go to the public hospital, they spend 5 minutes there, and then they disappear to their private practice. But you see, that's not going to happen in Singapore. Because the public in Singapore is educated, they are aware of their rights, and they're not going to tolerate this, especially in this era of social media. See, so I think that the trust barrier has to be broken. See, there has to be trust. the public sector will deal with this kind of doctors. If the doctors want to make a bit more money, then they have to be paid a certain proportion of their salary. The rest of the time, they can go and find their own money, go into the private sector, do locum or whatever it is. That's all I have to say on that.
Yep.
See, Prema, the problem is the way the healthcare financing works. As I understand it, the public hospital has to collect enough money from the non-subsidized patient to cover the subsidized patient. You think they're very happy every day when you go, the guy tells you, oh, actually your problem is not so serious, but you never know, can be very serious. So if you're a subsidized patient, you have to wait 3 months, 6 months, like Paul, I'll say 12 months. But if you are willing to upgrade to non-subsidized next week, I can do for you already. And the professor will do for you. Cannot only the doctor on duty, maybe you cannot understand the word the person is saying to you. Right? So you think they like doing this every day? They are selling literally selling, marketing the non-subsidized, services in order to subsidize the subsidized one. And as long as this continues, this problem will escalate.
Paradigm shift, that's what I'm talking about.
I think to answer Rema's first question, SDP has come out with a very good healthcare proposal, which I think addresses that as well. In principle, NSP as a party think that it's a very good proposal, but it's not the healthcare policy that is in place now for us to add value to it or to critique it or whatever. So we are sticking. So our proposal today and our recommendations today are on the existing system. But if one day there is a change and SPP's proposal comes up, I don't see any reason why as a party we can support it. We should not support it.